Good morning, President Korbelak, Vice President Hummer, Dr. Arlotto, and members of the board. For the record, my name is Jody Rissi, and I'm one of the co-chairs of the Wellness Council. I am honored to work with such a great group of colleagues that truly understand the positive outcomes and impact that health and wellness have on all of our students' success. Deputy Superintendent Monique Jackson successfully leads our team to new heights while we create communities of wellness in all schools and all offices. It is my pleasure to formally welcome you to Healthy Anne Arundel Month, a month that recognizes the Anne Arundel Coalition and all the agencies that make health happen right here in Anne Arundel County. Not only is this annual update a requirement from the United States Department of Agriculture, it also provides the Wellness Council a way to celebrate our successes and our partnerships throughout the school system. Joining me today are colleagues and students from our schools in the Wellness Council, who will be sharing information about 5 of the 10 components represented in the Centers for Disease Control school health model. The whole school, whole community, whole child approach emphasizes the relationship between education and health by putting the student as the focal point in the center. When reviewing this graphic, you can see that the student is encircled by healthy, safe, engaged, supported, and challenging environment. The white band emphasizes the alignment, the integration, and the collaboration to coordinate policy, process, and practices to improve learning and health. The blue sections represent the multiple school components acting as the hub that provide the full range of learning and health support systems for each student, in each school, and in each community. Anne Arundel County Public Schools incorporated this model with the inception of our wellness policy in 2006. In addition to hearing from our colleagues and our students, we're also going to hear from one of our new wellness schools of distinction and the role that wellness plays in the school each and every day. This wellness school of distinction is truly a reflection of the local community, serving as the hub to support health, wellness, and education. Without further ado, please let me introduce Teresa Tudor, who leads our parent involvement team and who will showcase how we are supporting wellness.
Good morning. We would like you to see wellness in action. The clip you're about to see shows how parents, business partners, staff, and students are making our wellness policy a living, breathing document.
Employee wellness here at Northeast High School is alive and well. Here at Eagle Land, it offers a lot of opportunity for teachers to get out and do things.
This year, we started Tai Chi under the lights, right in our turf, in our stadium. We offered it to parents, students, and any community members to come out and get their exercise in before the day even started.
As a North County High School graduate and a local business owner, we are proud to give back to the community by helping with wellness awareness.
What we are here to demonstrate to you today is what I like to call MacGyver cooking. I mean, we need to shop right and we need to save money, we need to look at value deals. Just sitting down and doing that whole like family dinner, doing all the family prep cooking is something that good quality time. It's a great way to hang out, great way to, talk to your kids and kind of pass down some traditions.
When renovating our existing schools or building new, our designs include increased natural light and quality views to the outdoors. This helps to provide a healthy, motivating learning environment for our students and staff. An example is the courtyard for the new Severna Park High School, which offers an outdoor education classroom while delivering natural light to the corridors.
Human Resources Benefits has recently hosted focus fairs which concentrate on a particular health condition. What to expect when you're expecting was the first fair, and last month they organized a Diabetes Academy. A partnership between a local yoga studio and Riviera Beach Elementary allows their students and teachers to learn yoga skills to improve their physical and mental wellness.
Next, Kathy Steen and Maisha Walker and our students will share with you community involvement in action.
Hello. As the community involvement representative of one of our goals is to foster community of wellness within all of our schools. The Office of Equity and Accelerated Student Achievement has set out to establish District 203. One of its tenets is growth mindset. In a growth mindset, students understand that their talents and abilities can be developed through effort, good teaching, and persistence. Sometimes our students may display a fixed mindset because of stress, anxiety, and other factors that may be going on in their lives. When this happens, students may display frustration, anger, and shut down. Learning stops, and often unwanted behaviors may take its place. Through the support of our equity liaisons, we offer professional development on all of District 203 tenants, as well as other related topics. We also have provided techniques and strategies to help students get back on track and demonstrate that growth mindset. One of the strategies that helps our students is breathing. Today with us, we have Isabel and some of her friends who are going to guide us into these breathing techniques.
Hi, my name is Isabel, and I'm going to teach you some breathing strategies to relieve stress. Please stand up. The first one is called STAR. Stand like a star, smile, take deep breaths and relax. Make sure you push your stomach out as you breathe in, then slowly exhale, bringing your belly back in. The next one is called balloon. Place your hands on top of your head and interlace your fingers. Breathe in through your nose, raise your arms, and inflate your imaginary balloon. Release the air slowly by making a balloon sound. Next is the drain. Extend your arms and pretend they are faucets. Open the faucets and let your stress drain out of you like water. Exhale and make the sound. Finally is the pretzel. Cross your ankles and cross your arms and bring them into your chest. Push your elbows down towards the floor. Put your tongue on the roof of your mouth and breathe. Thank you. Now please be seated for the rest of the meeting.
Good afternoon. My name is Maisha Walker. I'm from the Office of Equity. Hopefully today Isabel and her friends have taught you some techniques that you can use when you experience a fixed mindset. Now I'd like to take a moment to acknowledge the 5 schools who were recognized as this year's Wellness Schools of Distinction. They are Benfield Elementary, Oak Hill Elementary, Germantown Elementary, Northeast High School, and South River High School. We have the pleasure of having Karen Sanera, principal of Germantown Elementary, here with us today. She will share with us some ways her school has promoted wellness.
Thank you. At Germantown Elementary School, we inspire students to eat healthy, be nutritious, and have a focus on lifelong fitness as we partner with our students, staff, parents, community, and business partners. Many of our assemblies focus on wellness, with Kaiser Permanente, eating healthy, as Yojo teaches how to eat right. Our Dental Health Smiles program, our Career Day speakers with parents and business partners from the community. We focus our morning news with healthy eating tips each morning and a yoga move to get us started right. Our children especially enjoyed the Bicycle Safety in the Community program, where they learned how to use equipment that could keep them safe and hand signals for safety in the community. Our physical environment and physical activities involved many fun things. Our Spark initiatives through our PTA helps purchase outdoor recess equipment where we have movement stations for children at recess. Our after-school programs include our dance program and many of our soccer activities after school, as well as our evening events such as our parent versus student soccer games. Our students are energized in the fall and spring with our partnership with Annapolis High School as they come and teach yoga to our students. And we were especially proud of the 300 pounds of Halloween candy our students collected and used at the dental buyback program for recess equipment to use outside.
Many physical activities keep us moving at Germantown. Such things as our Just Fit, where kids hop off the bus and take a lap around the school, stopping at exercise stations before the beginning of the day. Our Capitals hockey partnership, where they donated equipment for us to use throughout the school day. We participate in National Walk and Bike to School Day. Our Mighty Milers and Girls on the Run, and even our soccer sign-ups help all of our students become engaged not only through the day, but at the end of the day as well. And we appreciate our faith-based partners who helped organize a 5K run to support our Backpack Buddy program. Our nutritional environment provides lots of education about healthy foods for students. We include the Tasting of the Rainbow monthly in our morning news, and our PTA helps grant fund fruits and vegetables so all children can have a taste of the rainbow. Our children plant strawberries, and we even have a salsa garden growing out back in the springtime. Whole Foods provides us with opportunities for cooking in the classroom, and that's a lovely partnership that we have through a grant with them. Our celebrations for students always focus on healthy foods and healthy initiatives. We have 3 outdoor classrooms. That provides lots of fresh air, sunlight, and a breezy way to learn. It's also fun at school to learn about eating healthy and also to make sure that we're applying wellness as students learn. Our PYP units of inquiry focus on healthy eating and wellness. Many research tips and research topics that students present all focus on wellness. Our PE classes and wellness topics also help to support this. We also have many green school initiatives that help support our wellness and healthy eating. For staff wellness and social emotional climate, there are lots of fun things that we do, including our Mindset Mondays, our walking clubs with staff, our after-school hallway workouts, and all the PD that includes movement for a positive environment. Arts integration helps keep our students moving with the support of Rob Levitz and another organization called the Baltimore Hip Hop that teaches us how to connect movement with learning. Parents are involved with educational opportunities in the evening and morning with PDs that we offer for them. The Title I presented a healthy eating and wellness topic for parents, our partnership with Children's Guild, our 1-2-3 Magic, and our PBIS social skills studies. There are many things that we've done at Germantown and will continue to do to keep our school healthy and well for all students and staff. Next, we're going to hear from Maureen Grisio from School Health Education.
Hello, I'm here to share health education in action. One of our wellness goals for this year was to ensure all students receive hands-only CPR as part of their health education experience. Today, you will see how one Chesapeake High School student utilized the life-saving skills of hands-only CPR, which she learned in health education and then became fully certified in her sports medicine class to save a life. So please take a few minutes to hear from Amy Fisher of Chesapeake High School.
I pulled over and the woman came up to my window and she was frantically asking for my help. And at first I was extremely doubtful of myself and I wasn't sure I could do anything to help. So I had to get myself together and I pulled over and I was like, Amy, you know what you have to do. There's no question. You have to do this. So I got out of my car and I went up to where the scene was. At this point, I hadn't even seen what was going on, but I decided I needed to do something. So I saw a man on the ground that had just had a heart attack, and he appeared blue in the face, completely lifeless. My heart dropped, but I knew I needed to help. So I kneeled down next to the man that was trying to give CPR, and I asked him to introduce himself to me. I said, hi, sir, what's your name? I'm here to help you. My name is Amy Fisher. And he said, my name's John. This is my dad, and I need to help him. I need to be the one to do this. So I said, I do know CPR. Would you be more comfortable with me taking over? I know I can help you. He said, no, I need to be. He was very persistent on helping his own father, which is understandable. And I was just a kid, so I know he's probably thinking, really, put my life into the hands of a kid. But eventually, he did let me take over, and I started CPR. And another bystander came over, and I said, you need to call 911, please. Get them on the phone and get them here. So I started CPR with my compressions that I learned in health class first, but I actually learned full CPR in sports medicine. And while I was doing this, I was actually had a lot going on in my head. And I'm also trying to keep the family calm, like nothing to worry about, like it's gonna be okay. I'm also thinking, do I do breaths? I don't have a tube for his mouth, or I don't have anything. Do I do this? And I came down to it, I couldn't do it. It wasn't the dummy in sports med class, it was a real person, and he wasn't alive. And I had kept checking for the pulse, nothing was happening with that either. And finally, another woman came over and she said, I used to know CPR. I used to be a lifeguard back in high school. I don't know if it's different, but I can sure help you. And I was like, of course. I was getting tired at that point. The woman took over for compressions one last time before I took over again. The paramedics showed up and I gave them space to do what they had to do. I went over to the side where the bystanders were, because that's where my other friend was standing. And there was actually a nurse there, and she approached me and she was like, I am astounded with you. She was like, you were so brave that you went and actually did that. You're just a kid, and you stood up to it, and there's all these people here that didn't. And it really touched me in just a crazy way. At that point I knew, like, this is what I need to go into. Like, this is what I need to do. So, and I asked her, why didn't you come over and help me? And she was like, you had it. Like, you had it under control. If you needed help, I would have came and helped you, which was also just awesome.
This is a great representation of the skills taught in health education. Not only do we impact the lives of our students, but also the lives of the members in our community. For those of you who are wondering, the man in the video survived, and Amy, who is not able to join us today, wanted to mention that this experience helped confirm her future goals to pursue a career in nursing. I would like to now introduce Christiana Walsh, co-chair of the Wellness Council.
Good afternoon. I would like to thank the many members of our Wellness Council who have joined us today. If they could please stand and be recognized for their continued efforts to place wellness first on behalf of the students and staff in Anne Arundel County. On behalf of the Wellness Council, we thank you for this opportunity to share how wellness is the key ingredient to the success of the whole child. What we do cannot happen without the support and leadership from each of you, and for that, we thank you. Together, we truly can cultivate communities of wellness.
Thank you all for a great presentation.